trying.
All right, guys, this is me. This is Jason.
What's up? How's it going?
I'm about to get dry needled. If you've never been dry needled, can you give us a little explanation of what dry needling is?
So essentially, we're finding a trigger point in here. Can I tell them about what you're
Yeah, go for
having
it.
going on? So Bronson's got some medial epicondylitis going on, or good old golfer's elbow, even though he doesn't golf a whole lot. Likely from him changing things up a little bit with his programming and going from a little more CrossFit based to some more strength based type of training, probably higher load, higher volume, and a lot of pushing.
Yeah, a little more grippy, more barbell, dumbbell stuff.
That and a lot more typing lately probably would
Yeah.
contribute. But essentially what we're going to do is we're going to find this trigger point and we're going to try and get a couple needles right into it, elicit a muscle twitch, and get this muscle to reset. I like to use some Stim in there because you don't need to poke and prod quite as much, and you can get a lot of bang for your buck. It doesn't leave you as sore. I will say though, the smaller muscles in the forearm can be a little more sore. So if you see a small bruise from the needle, don't be alarmed.
Should I, how long should I wait after this before I can start lifting again? Because I'm supposed to bench today.
You can get right to it.
Okay.
After this, you can go right out and get
Can't miss bench day.
Now it's actually good to get the muscle to reset and decrease that trigger point and then get you to own your movement. Now I would say, because you have inflammation, don't go pushing through pain. Like, listen to your body.
Sure.
Be smart.
You hear that? Don't push through pain.
Not with this. This isn't one of those situations. You're not going to make anything worse in this case, but if we're trying to get it to calm down and go away,
Right, it'll just keep bugging me forever.
yeah, we want to get it to resolve. All right, now if you feel anything really sharp or zingy, let me know.
Zingy? It's supposed to be zingy, isn't it?
You're gonna feel like a muscle twitch is the goal, but we got a couple nerves that we're gonna dance around. Obviously this area gets a little tight.
Well, the closer you get to the joints, right?
Well, just this is a small part of the limb, and we have a bunch of nerves that go down to your hand. Ready?
Mm-hmm. Ooh, there it is.
Little twitch.
Yeah. Oh, there it is. Oh.
Alright, leave that one right there. We're gonna thread one right through the top.
So it's weird, guys. It's not really like a pain. It's just kind of like, I don't know, like some of you, like you got, if you've ever used a lacrosse ball, it's like a really fine, small location that the muscle's getting pushed on.
That one didn't stitch very well. God, sucker is fired up, man. You did a number on that guy. That's a good twitch right there. All right. So now we're gonna run some Stim through it. I don't like to piston and poke and prod. I like to go more of the train of thought where limit the trauma and the bleeding and the scar tissue. Even though it's very minimal with the technique, I don't like to piston. I like to get right in there, get that muscle twitch, and then run some Stim through it. And then start to really just confuse the nervous system with some higher frequency Stim here.
Guys, that is not me doing that with my hand.
Now, if you go a little faster with the frequency, you can really get a good response. Let's pull a little bit on that one needle. And it tends to lead to less soreness afterwards, which I've found through my experience is pretty minimal. You usually feel really good, really fast after this, especially when we combine it with some myofascial or counter strain or ART, Gaston right after this. And you're getting a strong contraction on that one.
It's all the meat.
But see, now it's slowing down and getting a little more rhythmic. Still confused though. We want to see this start to get to a point where it just pulses nice and rhythmic.
That is crazy.
There we go. Now it's starting to sort out.
So what is that? The muscle receiving the signal, not knowing what to do with it?
Yeah,
basically?
initially it was really knotted up and it just wasn't firing in sync with the rhythm. But here we go. I can see it's starting to get it.
It feels like I'm getting a forearm workout. Jeez.
Yeah, usually, like I had this done in my neck after my car accident. It felt like you just got a really good trap workout. You hit a bunch of shrugs. You might see a tiny little drop of blood from the pinprick,
Sure.
but very minimal.
I haven't before. Oh.
And now if I'm right over that same muscle, it feels way less knotted and bandy as it was a minute ago.
It's weird, actually. Yeah, it actually, like my arm feels looser.
It's pretty instantaneous. Now we're gonna really do some work in here and get it to loosen up. Work through some stretching. All right. Where's my magic sauce here? Gaston's wines.
This is good too. If you guys have never been Gastoned, it's a form of myofascial release that basically uses I want to say a sharp instrument. It's not really sharp. It's just hard and rigid, right?
Yeah, it's got a rigid edge to it. Just helps break up some fascia and soft tissue in there. Any adhesions. Because you have all the connective tissue, fascia that goes over the muscles, and you have the byproduct. See where he's getting red? That's where he's all knotted up. If you go over other areas, it tends not to get as red if it's not restricted. But where you get the most redness is where you have the most fascial restriction.
This is the most gentle grass that I've ever had, by the way.
So you hear some stories about some vicious grafting. It really doesn't need to be aggressive. I mean, you can get in there, but it shouldn't leave you bruised. You should get some redness. It should be a little uncomfortable if you're in a really restricted area, but it doesn't need to be violent, abusive to get
I've had some
results.
I've had some grass that I'm just like,
I mean, I've actually had some
hard and fast, and you're like, good Lord.
I've actually had some patients come in, even athletes, and they'll have bruises looking like their knee or IT band got Nancy Kerrigan to it. But yeah, it should not be like that. The technique should not be creating more trauma and inflammation for your body to react to and have to heal from. It should be helping the cause, not hurting it.
Right.
This is so much looser.
I can tell you right now, it feels better already.
But that's
Like
pretty
when you
much
did that earlier, like you could feel the tightness. Like that doesn't feel any. I almost don't feel that at all.
You have a tiny little bruise from that one needle, but
Right.
this is already 50% less restricted than when you started just 10 minutes ago.
Yeah.
One session, first time in. It gets good results. I was hesitant more so because of time to get certified in dry needling. But man, it's a valuable tool.
Yeah,
I'm so
I like
glad
it.
I finally made
Ooh,
time.
there's a spot.
Yeah, to get in there and get it done. Definitely has been a nice way to accelerate some response to treatment.
So what are some things that people can do so that they don't get these types of chronic or recurring? Because you see people a lot of times have the same thing happen over and over and over again, right?
Yes,
People come in
especially
with-
in our field and what we do, or even not professionally, but just as someone that likes to train. You want to limit any large changes in the volume, frequency, or intensity of your workouts. So probably the most popular one for me with young athletes is they don't maintain a proper off-season conditioning program. So the season rolls around and the team's getting ready to start practice, and say for a baseball player,
Right.
they haven't been doing some rotator cuff, some band work, and then all of a sudden, you know, it's practice time, they pick up a ball they haven't been throwing.
Right.
So you go from nothing to 100 real quick.
Yeah, yeah.
And sudden increases in volume, intensity, or duration is what cause tendonitis.
Okay.
Or say you've been training, like you, and then you change your mode or frequency, or say you're used to doing a lot of Metcon type stuff, and then all of a sudden you're working more on strength.
Right.
Your weights go up, your volume and sets is changing, so you just went from maybe doing all body weight type stuff to heavy presses, heavy curling, curling after you do a lot of lat work. So all that change in volume and intensity, it ends up just irritating the tendons. But that's usually what causes. So trying to limit like drastic changes.
Work yourself into stuff. Don't just.
Yeah, but you know, we all just want to go hard right away, and no pain, no gain theory. But sometimes that can be what leads to the issue. Our egos. But stay prepared. Transition into things in a more calculated way.
Okay.
All right. Man, we're making some progress here. This looks good.
All right, guys. We can sit here for another 10 or 15 minutes while he works on this arm, but you guys get the point. Dry needling with electric stim, grassoning, and some massage and stretching. Make sure you take your time when you make changes to your program, all right? Don't just jump into something you haven't been doing or haven't prepared for. Peace out.